Let's get started. Hello, good day, everyone. Be welcome. I'm Dr. Eduardo Lara Perez on behalf of the Medical Fraternity for Health, Médicos Unidos for Mexico, and physicians of the State of Veracruz. I would like to welcome you this Friday, September 19th of the year 2025. Today we have a very special guest, and it's an honor for me to welcome Dr. Paul D. Williams, who will speak to us about climate change. It will take your breath away. Dr. Williams was born in the state of Washington. He studied medicine in the School of Medicine of the University of Washington, and with a specialty in pediatrics in the Medical Center of the Rochester University, New York, with a subspecialty for allergy and immunology, which he completed at Washington University. And from there, he became part of the Center for Allergies and Immunology in Seattle, Washington. And if we take it by the decade, between the 1990s and 2000, he participated as main researcher for allergies research. And he has published many articles and scientific papers, most of which addressed problems with asthma and allergies. He also became a clinical professor of the Department of Pediatrics for the Washington University. In 2009, he received the award for the allergy and immunology for the Academy of Pediatrics, and he was acknowledged in 2020 as Professor of the Year for Allergies by the American Association of Allergy and Immunology. In 2014, he also received an award as volunteer, and in many occasions he was a top doctor in Seattle between 2016 and 2018. And in 2021, he left active practice after 30 years of service and was named emeritus physician. In 2022, he became a secretary of the American Society of Allergy and Immunology. In 2023, he published several articles for asthma and immunology. He received an acclaimed response from the work that was done by the Society of Allergy and Immunology, and recently he left the presidency of the American Academy of Asthma and Immunology for 2024-2025, and he has received many awards: award for allergologist, teacher of the year, award for the clinical professor. And in his personal life, he has worked with his community with a service attitude and resilience and empathy, and he has been a volunteer commissioner for a fire department in his community. So it is an honor for us to have the presence of Dr. Williams today. Welcome, Dr. Williams. You have the floor.
Thank you very much, Dr. Lara Perez, for that wonderful introduction. Just one thing I want to say is that Washington University is actually in St. Louis. I actually got my training and am on the faculty of the University of Washington. So it's not much of a difference, but it is a little bit of a slight difference. Okay, so today's topic is going to be climate change. It will take your breath away. And our objectives this evening are to understand the impacts of climate change on the ecosystem and respiratory disease, to be aware of vulnerable populations, to develop plans to manage exposures to pollutants, and advocate for climate responsibility. Climate change is due largely to rising global temperature and increased CO2 in the environment, which has an impact on indoor allergens, pollen, and air pollution. So the increased frequency of severe weather events as a result of climate change leads to flooding and property damage with displacement, increased mold growth, and increased dust mite burden, which leads to exacerbation of existing allergic disease and perhaps greater risk of developing allergic disease. Primarily due to the increase in CO2 in the environment, we have longer pollen seasons, increased pollen production, and greater allergen potency, all of which result from a direct effect of the increased CO2 on the plant. Rising global temperatures have led to shifting geography of allergenic plant growth and longer pollen seasons. And that too exacerbates existing allergic disease and questionably increases the risk of developing allergic disease. Most of my talk today is going to be focused on air pollution. And that's due to increased burning of fossil fuels for cooling because of the rising global temperature. Directly, this increased heat causes acceleration of ground level ozone formation and leads to the increased risk of wildfires and particulate matter associated with those wildfires and subsequent deteriorating air quality. This clearly leads to an exacerbation of existing allergic disease. And also there's good evidence that it does indeed lead to a greater risk of developing allergic disease. So who's responsible for all these cumulative carbon dioxide emissions? And this is a pie chart that looks over the last 270 years of cumulative carbon dioxide emissions. And the United States, Europe, China, and Asia are probably responsible for 75% of those carbon dioxide emissions. But Latin America and the Caribbean, only 4%. So even though you only produce 4% of the carbon emissions, you suffer from the effect of all the other emissions. So we're going to start by talking about climate change. And what is climate change? Well, it's temperature extremes, so you have heat and you have cold. It's weather disasters, tornadoes, floods, hurricanes, cyclones, heavy rainfall, and also wildfires. So the increased temperature and drought conditions lead to those fires and increase the risk and frequency of fires. So temperature extremes include heat, and heat has direct effects on the respiratory epithelium and skin. It leads to increased level of ground level ozone. It has the effect on the pollens that we've already talked about, and also is associated with mortality. It also has indirect effects in that it leads to these weather disasters and wildfires, which go on to cause additional problems that we'll discuss a little bit later. And then there's also cold, and cold has its own direct effects on the airway, skin, and mortality. And actually, airway mortality or mortality from temperature extremes is greater with cold than it is with heat. This is a graph showing the global ocean and land temperatures over the last couple of hundred years. And you can see that these temperatures have been rising since pretty much the 1960s. And this is data from the National Oceanic and Atmospheric Administration in the United States. And additional data shows that the frequency of heat waves, the duration of heat waves, and the intensity of heat waves have also been steadily increasing since the 1960s. And the length of the annual heat wave season has also been increasing. So moving to weather disasters, so those are an indirect effect of excessive heat. They include heavy rains and floods, which leads to indoor mold contamination and also increased airborne pollen levels due to fractionation from the precipitation. Thunderstorms increase airborne pollens in a similar manner, but also are associated with increased amounts of fungi in the environment and in the air. And tornadoes and dust storms increase particulates, but also spread soil bacteria and fungi. So dust storms are a common occurrence in the southwestern states in the US. And this was a study from JAMA, Network Open in 2025, that showed that there is the increased risk of ED visits for asthma following these dust storms. Now, I'm going to focus a little more on wildfires because there was an interesting paper in Nature from the last couple of weeks that indicated that wildfires and the pollutants that result from wildfires are leading to increasing amounts of all-cause mortality in the United States, and they predict it will be the leading cause of all-cause mortality in the US by the middle of this century. So let's look at some statistics. First, in the United States, the National Interagency Coordinating Center is responsible for keeping track of wildfire statistics. And in 2024, there were 65,000 wildfires in the US in 2024 and burned 3.6 million hectares. In Canada in 2025, so this year, which these fires are ongoing, they've had 4,400 fires as of mid-August. But even though they're less fires than the US, they're much larger fires, and they've burned 7.3 million hectares. So 2023 was a bellwether year for Canadian wildfires, and they had an increase in probably 7 times the number of acres burned compared to the previous 10 years. And those wildfires had an impact that were thousands of miles away. And this is a photograph of the air in Baltimore, Maryland in June of 2023 as a result of the Canadian wildfires, even though they're thousands of miles away from those wildfires. And this is the level of particulate matter concentration in the air at that time. And the EPA, the Environmental Protection Agency for the US, considers 24-hour level of 35 micrograms per cubic meter as being the upper limits of allowed particulate matter. And you can see that on those 2 days, it was up to 3 times that level. And the smoke was incredible. You can see that the smoke covered almost all of North America, with significant smoke covering a broad swath of the United States, including Baltimore City. And you can see that Mexico and parts of Central America were also affected, even though the fires were thousands of miles away. So we've been seeing similar things in California, where we're seeing more large wildfires. So the number of fires varies from year to year, but the trend on size of fires has been increasing over the last 10 years. And an interesting phenomenon is that we're seeing increasing global human exposure to wildland fires despite declining burned areas. So even in North America, though we have increasing burned areas, overall in the world, primarily driven by what's going on in Africa, the cumulative burned area is declining, but the human exposure is increasing. And the reason for that is that human settlements and the urban developments are encroaching on the wildlands. And so when they burn, there are more people that are exposed to the pollutants. And in Mexico in 2024, there were 8,000 wildfires that burned 1.67 million hectares. So even though a lot less wildfires than we've had in the United States, it was a 60% increase over 2023. So wildfires are important and very important sources of air pollutants. So let's talk a little bit now about the air pollutants themselves. So first of all, there's ground level ozone, and that's considered a secondary or transported pollutant. And it takes a combination of sunlight, volatile organic compounds or VOCs, and oxides of nitrogen plus carbon monoxide to produce ozone. So typically you'll see higher levels of ozone in areas perhaps a little bit distant from the urban population because it takes some time to develop. Particulate matter is probably the most important pollutant with respect to respiratory disease and skin disease and wildfires. And this is a combination of solid and or liquid particles that can carry a variety of substances, including heavy metals, PAH, which is polycyclic aromatic hydrocarbons, allergens, bacteria, fungi, the volatile organic compounds, as well as bioaerosols. The deposition of these particulate matter depends on the size. So we have sort of three categories of particulate matter. We have coarse particulate matter, which is 10 microns, between 2.5 and 10 microns in diameter. Because of its size, it impacts primarily on the upper airways and the skin. And then we have fine particulate matter, PM 2.5, which is 2.5 microns or less. And that will get into the lower airways all the way to the alveoli. And then we have particulate matter less than 0.1 microns, or perhaps ultrafine particulate matter that may be the most important and gets into the systemic circulation, but it's not as well studied as PM 2.5 and has been difficult to monitor. So this is a size comparison. This cartoon kind of gives you a feeling for what size these particles are. So we've got fine beach sand, for example, is 90 microns in diameter. The human hair is 50 to 70 microns. So again, PM10 or coarse PM is less than 10 microns. And PM 2.5, you can see these little tiny particles. That's why they get into the airways. So other air pollutants include oxides of nitrogen, with nitrogen dioxide being probably the most important. And it comes from fossil fuel combustion, but can be produced indoors as well as outdoors. There's carbon monoxide that is also a component that occurs from fossil fuels. Sulfur dioxide is also a fossil fuel pollutant, but it's more of a point pollutant. It tends to be concentrated around power plants and industrial facilities that are burning fossil fuels. And we don't think of this very often, but lead and other heavy metals can also be considered air pollutants. And actually in the LA fires from 2025, Los Angeles, there is a fair amount of lead measured in the air. There's also TRAP, or traffic-related air pollution, and that's related to traffic, obviously, and it's a mixture of particulate matter, or PM 2.5, nitrogen dioxide, black carbon, and what are called diesel exhaust particles. And diesel exhaust particles are interesting because they can actually promote de novo synthesis of IgE to allergens, even without prior sensitization. And then there are the volatile organic compounds that we'll refer to as VOCs. And these are chemicals in the air with variable volatility and include such chemicals as benzenes, toluene, phthalates, and isocyanates. And then the polycyclic aromatic hydrocarbons, which can penetrate into the systemic circulation and actually impact the cytochrome P450 enzyme systems, so they can have adverse impact on drug metabolism. So indoor air pollutants are important because adults spend 90% of their time indoors. Generally, indoor air pollutants are a complex mixture of pollutants that are determined by the local ambient air pollution, the amount of that air pollution that infiltrates into the home or the workplace, and indoor sources. So indoor sources include combustion products that come from cooking, heating, or tobacco use, but also building materials and furnishings, household cleaners or personal care products, and in-home activities, hobbies, or even in-office activities and the equipment in offices. So the local ambient air pollution and its degree of infiltration, as well as indoor sources, are dependent on what we call the built environment, or the structure of your home and its surrounding environment. So indoor air pollutants include PM 2.5. There are a multitude of indoor sources of that, and there's also the outdoor sources that can infiltrate indoor spaces. There's nitrogen dioxide, and that comes from high temperature combustion from gas and kerosene appliances. And there's ozone, most of which comes from outdoors. But if you have air purifiers or laser printers or disinfecting devices in your home or office, then that can also produce additional ozone. VOCs, or volatile organic compounds, as I mentioned, are a variety of chemicals. Here's some others that are listed, but in the home, you have acetone, plasticizers, and fire retardants on furniture. They're components of products that are used in the construction of homes, furniture, flooring, and carpet. They also can be produced by tobacco smoke, cleaning products, air fresheners, and gas appliances. And volatile organic compounds indoors are 2 to 10-fold higher than they are outdoors. And indoor air pollutants are often mixtures. For example, tobacco smoke is a mixture of particulate matter, aerosols, and gases. Cooking with gas stoves, the combustion associated increases the levels of particulate matter, ozone, and nitrogen dioxide. And particulate matter, particularly when you're frying foods, increases. And then if there's biomass smoke or wood burning appliances, you'll get a mixture of particulate matter, nitrogen dioxide, volatile organic compounds, and the polyaromatic hydrocarbons. And recently, radon has been classified as an indoor air pollutant. So moving back into wildfires, I want to talk a little bit about the chemistry of fires at the wildland-urban interface. And when you talk about wildfires, you're really talking about 3 different types of smoke. And the pollutants produced from wildfires really depends on what's burning, where it's burning, what the temperature is, the wind, and so forth. But first of all, you have the wood smoke. So smoke that comes from burning of wood or trees. And that produces black carbon, organic carbonation species. And then you have biomass burning, which is burning of the floor of the forest. So you have leaves and moss and grass and small bushes. And that leads to the production of increased levels of nitrogen and sulfur, as well as black carbon, but also inorganic chemicals, and interestingly, bacteria and fungi. And those bacteria can be in significant concentration. And then I'd like to talk about wildland-urban interface smoke, and that's what's causing increasing concern. And this is a picture of the LA wildfires from earlier this year. And this is biomass burning plus everything in the urban environment. So homes, autos, and electrical infrastructure. And as we'll cover, the pollutants from wildland-urban interface smoke are probably some of the worst pollutants that we can be exposed to and responsible for significant increases in morbidity and mortality. So this is a drawing of a house. And when you think of the house, maybe you don't think of everything that goes into building a house, but of course, mostly wood and structure, at least in the US. But the contents, there's a lot of plastic and fabrics. And the other thing that we don't think about is that oftentimes there are vehicles in the driveway, in the garage, on the street, and they're mostly plastic, rubber, and fuel. And these are materials that are used in buildings, and these are the fire emissions that come from those burning buildings. So you can see that it's a variety of volatile organic compounds, carbon monoxide, oxides of nitrogen, cyanide, isocyanates, just a lot of really toxic air pollutants. And in the cars, you've got all these components in the cars. And again, quite a variety of toxic pollutants that are produced when those cars burn. And we talked about heavy metals in the air. A lot of those come from cars, and you can see the lead that's in the air in milligrams per kilogram from burning cars. And this was what led to high levels of lead in the air from those LA wildfires. And then volatile organic compounds, these are actually measured in wood fire or wildland urban interface smoke that's collected by planes in the atmosphere. And these are the variety of volatile organic compounds, including formaldehyde and methanol, and as I mentioned, benzene. And many of these are actually carcinogens. So let's jump now to vulnerable populations. So who are the people that we need to identify as at-risk populations? Well, children, the elderly, pregnant women, wildland firefighters for obvious reasons, but also people who work in agriculture or construction because they're working outdoors and exposed to outdoor air. The unhoused for similar reasons. People certainly with pre-existing disease are more vulnerable. And there's an interesting relationship between obesity and nitrogen dioxide. It has an impact on pulmonary function that you don't see in people who are not obese. This slide may be a little bit difficult to read for you, but it talks about susceptibility factors in fetuses, infants, and children and why they are more at risk. Well, they have longer exposures over their lifetime. They spend more time outdoors. For body size, they have increased air and water intake. They also have developing organs, poor thermoregulation under extreme heat conditions, more permeable skin and blood-brain barrier, and less effective nasal filtration. And then there are additional conditions that may impair their ability to adapt. So worsening nutrition and increased food scarcity, and inadequate access to healthcare during development, and a lot of times displacement in extreme weather conditions that exacerbate all of these things. So as a result, you've got fetus, infant, and child health effects that include allergic disease, dermatologic disease, and respiratory disease, in addition to many of these other disorders. And focusing again on the socioeconomically disadvantaged, at least in the United States, so we have problems with consequences of systemic racism, or social determinants of health, we call it. And they often live in substandard housing that is closer to roadways and lack of green space. It's also closer to industrial pollutants. There's income instability that plays a role, as well as limited healthcare access. Because of where they live, they're exposed to more extreme heat because they have a lack of green space. Flooding is more of a problem, as well as exposure to extreme weather. As a result, they have magnified exposure to mold, pollen, air pollution, and wildfire smoke, which increases atopic disease and asthma burden. So what are the mechanisms by which these pollutants cause disease? Well, the primary thing that causes disease due to pollutants is disruption of the epithelial barrier. So heat has direct effect on the desmosomes and adherent junctions of epithelial cells, and then the particulate matter, industrial pollution, and wildfire smoke causes additional damage. So you have receptors such as TRPV4 and TRPV1 on the epithelium and the sensory neurons. Those recognize these products as alarmins and result in increased secretory phase with increased mucus, increased cytokines and chemokines that promote a type 2 epithelial response. You have damaged cilia and epithelial shedding, which increases the paracellular permeability and subsequent inflammatory response. So additional impacts of these pollutants are that ozone and nitrogen dioxide can actually modify the chemical characteristics of airborne pollens and make them more allergenic. They're synergistic with high temperatures and other pollutants to create increased problems. Nitrogen dioxide can penetrate deeply into the lung, and both are associated with increased mortality. Particulate matter, particularly PM 2.5 and its constituents, have unique effects because what is carried on these particles depends on where they're produced. And so you can have a variety of different types of particles depending on the source of the pollution. But wildfire PM 2.5 is worse than non-wildfire, worse than indoors, which is worse than outdoors. Prenatal exposure to particulate matter can have epigenetic effects as well. Volatile organic compounds can induce upregulate other epithelial receptors, leading to an adjuvant type response in allergic disease to TSLP and TRPA1. You get increased Th2 cytokines, also transepidermal water loss. They can enhance cutaneous sensitization, and they activate the aryl hydrogen receptors, which can influence gene expression, particularly to increase the expression of pro-inflammatory genes. So what are the clinical or symptomatic effects of pollutants? Well, climate change in and of itself has an effect. So heat stress directly can decrease pulmonary function and increase airway hyperresponsiveness and lead to asthma exacerbations just from the heat. Weather disasters are also associated with asthma exacerbations, such as thunderstorm asthma and loss of control, and also decreased pulmonary function. Wildfire smoke has been associated with a decreased response to viral infection, so a limited immune response, and also increased asthma symptoms and exacerbation. And tornadoes and dust storms increase asthma symptoms and are associated with increased mortality. Now, individual pollutants such as ozone can interact with heat to lead to higher mortality, but it also has a direct impact on the airways with irritation leading to cough, mucus production, bronchial hyperresponsiveness, and inflammation. It's associated with a decline in pulmonary function in adults, a decrease in lung growth in children, and can interact with other pollutants with complex effects, particularly the volatile organic compounds. Nitrogen dioxide is associated with a loss of asthma control, new onset asthma, a decline in pulmonary function tests, and increased sensitization to allergens, but can also have an adverse impact on neonatal lung development that we'll expand on a little bit later. The impact of nitrogen dioxide is worse if there's pre-existing asthma or particularly in former smokers. Particulate matter and its constituents can reduce pulmonary function as well, more so in former smokers, increase asthma symptoms and emergency department visits, hospitalizations and mortality, increase the risk of asthma, and lead to more respiratory infections. Volatile organic compounds contribute to airway remodeling, exacerbate inflammation and asthma morbidity, and can even alter T cell populations when they enter the systemic circulation, and a potential adjuvant in those with allergic asthma. As we mentioned, it can sometimes be associated with changes in pollens. And radon, as I mentioned, is considered now an indoor air pollutant and has been associated with decreased asthma control in children. So the American Thoracic Society over the last few years has been developing reports called Health of the Air that cover 2-year segments. And they started this in 2015. And this article is from the 2018 to 2020 Health of the Air report. And it talks about not only outdoor air pollution, but now are starting to include wildland fire. And what they do is they calculate the preventable national annual health impacts from these pollutants that are anything greater than what their recommendations are for maximum tolerable levels. So you can see that PM 2.5 is associated with a median of all-cause mortality of up to 20,000, but respiratory, hospital admissions, and ED visits, new onset asthma that could impact as many as 200,000 people, and asthma symptoms in millions of people. Ozone above their levels is associated with respiratory mortality, also emergency room visits and hospitalizations for respiratory problems, new onset asthma, and increase in asthma symptoms involving millions of patients. Now, if you just look at wildland fire particulate matter, it also is associated with all-cause mortality, respiratory emergency room visits and hospital admissions, as well as new onset asthma and asthma symptoms. And ozone from wildland fires are a cause of respiratory mortality, as well as the other things that we've talked about. So as I mentioned, the pollutants associated with wildland fires, ozone and particulate matter, are becoming an increasing burden for those in the US and an increasing cause of mortality and morbidity. So this is going back to the Canadian wildfires in 2023. And what you have here is a graph of different conditions in the state in general, and then also other parts of the state, where the blue line is the daily mean particulate matter level, and the dotted line in these individual regions represents the baseline. So you can see that during those fires, the mean PM 2.5 levels were much higher than the baseline. And you can see these blue bars, which represent the number of asthma ED visits, nicely associated with peaks in particulate matter. And in Europe, the European Academy did a systematic review for their guidelines on environmental science for allergic diseases and asthma. And in the studies that they collected, you can also see risks, increased risks for ED visits from PM 2.5 and ozone. And what's interesting is that there's a lag time from time of exposure, with the highest effect for PM 2.5 3 days after exposure, and similarly for ozone. And then if you look at hospital admissions, PM 10 or coarse particulate matter is associated with an increased risk, as well as nitrogen dioxide and ozone. And we talked about new onset asthma and the epigenetic changes that can occur from exposure to pollutants. But this is a study in 2024 that looked at early life exposure to air pollution and childhood asthma. And what they found was that the risk of asthma incidence and the odds of asthma from exposure early in life to nitrogen dioxide and PM 2.5 were increased at 4 years of age and 11 years of age. So early exposure has an impact on the development of asthma at a later age. And they found that the risk was higher among minority families living in urban communities. They're with characteristics that we talked about earlier for socially disadvantaged populations. And so it's important to improve air pollution regulation if we really want to reduce asthma risk. And in another study looking specifically at ozone in combination with other pollutants, particularly particulate matter, there was also an increased risk of asthma at 4 to 6 years of age. So early life exposure is important. And this was a relatively low ambient ozone exposure. This is a study that looked at oil and gas development, and they talked about the life cycle stages and its contribution to pollutants. So they divided the development or oil and gas production into upstream and midstream life cycle. So that involves exploration and extraction, storage and transport, And then there's downstream effects of oil refining and gas processing, and then end use, primarily consumption of the petroleum. And you can see that the upstream, the exploration, extraction, and storage and transport are associated with the production of gases such as methane, formaldehyde, and acetaldehyde. And these percentages are actually a percentage of the total emissions for the continental US in 2017. So just the oil and gas production leads to significant amounts of pollutants. There aren't much effects from the downstream life cycle, but end-use consumption is clearly the worst, with carbon monoxide, nitrogen oxides, and many gases, and also particulate matter such as organic carbon and black carbon. And they looked at, in the same study, the health burden of ambient air pollution linked to the oil and gas life cycle stages. And this is divided up by states, with the states that were most impacted were the ones that are most involved in oil and gas production. And you can see that there was an increase in premature mortality, impacting 91,000 cases per year, preterm birth of 10,350 cases per year, asthma incidence 216,000 cases per year, and life cycle cancer incidence of 1,600 per year. And this graph will show you that virtually all of these health burdens are associated with the end use of the petroleum products. And what about the national, global, and regional mortality burden attributable to air pollution? Well, this is a study that looked at associated mortality rates around the world, and you can see that per 100,000 residents, there are increase in respiratory AMRs throughout the world, but the global south, particularly Africa and parts of South America and Indonesia, are most impacted. So it's a worldwide problem. So what can we as allergists do about this? Well, first of all, we can try to mitigate the problem. And that means try and reduce the pollutants that are produced. Nationally, we can advocate for change in policies that impact climate change. Locally, you can promote climate resiliency, so cooling centers for those people that don't have air conditioning, and air filtration systems in the home and at work, at schools. Increase social contact within neighborhoods, so neighbors taking care of neighbors, and urban green spaces to reduce the heat effect and the carbon dioxide level. And in your practice, even consider developing greener practices and greener health systems with less reliance on fossil fuel products produced from fossil fuels, and also fossil fuels used for heating and air conditioning. And when we can't mitigate, then we have to look at adaptation. And adaptation primarily involves education. You have to educate your patients, you have to educate your staff on the importance of air quality and its impact on respiratory disease, and maximize disease management. I like to say you need to improve your environmental and social histories. It's important to know where your patient spends time. So for example, children spend time at school. So what's the structure of the school? Is it an older school? How much time do they spend outdoors? What sort of occupations do the adults have? What are they exposed to in their occupations? What about the home? What about the neighborhood? All of these things are important. Do people have access to medical care? Are they close to sources of pollutants? And all of this is so you can identify patients that are at risk and deal with that. So here's an example of some tips to protect people with asthma and allergies from wildfire smoke. So it's important they keep medications on hand during the wildfire season, or even in areas that have poor outdoor quality for other reasons, such as traffic-related air pollutants. You may want to change their controller medications or their inhaled corticosteroid doses during those periods of time. So you want to have wildfire smoke and air pollution events sort of listed on the asthma action plan along with other asthma triggers. In the house, you can try and create a cleaner airspace using MERV 13 filters if you can put them in your air conditioner or heating system. If that's not possible, or maybe in addition to, you can use portable air cleaners in the home or in the school or in the office. But it's important that these are air cleaners with a mechanical HEPA filter and not an ionizer, because ionizer air cleaners produce ozone. And if you can't afford a portable air cleaner, there are ways to sort of build your own using a combination of a MERV 13 filter and a box fan. And you want to advise your patients to limit time outdoors, but if they have to be outside, they should wear a NIOSH certified N95 or equivalent mask. The paper mask and dust masks are not effective at reducing exposure to air pollutants. This is a little cartoon showing you how you can make those DIY or do-it-yourself air cleaner designs. So you can use anywhere from 1 to 5 filters. The more filters, the more effective it is. But these are all ways to sort of make your own air filter. And this is a study that looks specifically at using air filters in multi-settings, so home and school and children. And you can see that there's a definite benefit with an absolute increase in pulmonary function parameters in those that were using air purification compared to those not using it. And speaking of schools, I think it's important, for physicians to deal with schools and outdoor activities. Many times the schools aren't thinking about outdoor air quality and how that impacts the students. So this is one of many different types of graphs that have been developed by the Environmental Protection Agency in the US. And so you have green is good, purple is very unhealthy, and you have different ways of dealing with that with respect to the type of outdoor activities. You may need to tell your students with asthma on their asthma action plan that maybe they need to stay indoors when air quality is unhealthy for sensitive groups or worse. And then finally, I've got some resources for you to learn about air quality, to find handouts for your patients about air quality. Particularly useful is in the US, and you may be able to use it yourself, although it may not be accurate for your location, but airnow.gov, you can plug in your zip code in the US and get air quality and the air quality monitors in your area. But there are educational resources that are available at that website, and there are fact sheets for patients on indoor air quality. There are resources specifically for wildfire smoke. Again, EPA and fireairnow.gov, and a video on how to build that do-it-yourself air cleaner. And this is an example of one of those. You can also get handouts on extreme heat and indoor air quality in multiple languages from the EPA. And I seem to have lost my connection to my slides because I went to a website. So let me back up here a little bit and try and get us back on track, because there is one other thing I want to show you here. And that's I'm going to have to stop my share and restart it here. Sorry about this. One little technical glitch. Okay, so in the EPA, the other things they have are best practices guide for improving indoor air quality. And this is handouts on wildfires and indoor air quality in different languages. And the EPA has also worked with states in the US, and many states have gone on their own to develop some very good materials and resources. So here, the state of Montana, for example, has a wildfire smoke response toolkit, one for home and one for school. And these show you what are in these toolkits. There's checklists for clean indoor air, educational resources, and handouts on wildfire smoke on your health, but also for employers and employees. And this slide has a couple of websites that you can also access: the Western States Pediatric Environmental Health Specialty Unit website and the University of California in San Francisco Wildfires and Health Education Hub website have information on wildfire health risks and exposure reduction that's available in several languages. And here is the website that you can go to find out similar information on the air quality in Mexico. And you can see all these little circles represent air quality monitoring centers. And it even shows where wildfires are taking place. And you can get information for your specific location using this website. So that is all that I have to say. So if we have any questions, I'd be happy to deal with those.
Well, first, I want to congratulate you, Paul, because you have given us a great number of data and indications that are very complete, and you leave very little margin to comments because you have encompassed pretty much everything. But I did want to comment that last year in 2024, the Médicos Unidos por México, Physicians United for Mexico, with the University of Veracruz, we had 3 events, all of this aimed at the impact of health regarding climate change, water stress, and pollution. And we came up with very interesting conclusions, because the final conclusion was that having a healthiest of lives as possible, we would do better. And why do I mention this? Because with the COVID pandemic, we found out that we noticed that all of the things that we ceased to do in terms of promotion of health and early diagnosis of diseases under control. And Mexico was one of the most punished countries in terms of mortality due to COVID comorbidities, obesity, hypertension, diabetes, etc. And the story of these people that sadly died was actually marked us and children. And now what we now do is we'll have different activities. It had an impact in nutrition, and we adapted in Mexico being possibly the number 1 consumer, for instance, of sugary drinks and sodas in the world. So the quantity of water that is used for a sugary drink is impressive. So if we take into account that less than 1% of the total water in the planet is drinkable, we are wasting a lot of water. And additionally, it impacts our health, of course. So we launched this awareness campaign, a proposal for awareness campaign that say, I only drink water. And the University of Veracruz actually adopted the proposal by promoting only drinking water. So they established drinking spots with pure water where the students can refill their flasks, and we try to avoid and prevent single-use plastics, because these are the most pollutant ones and that most affect us. And so we created a campaign as part of this, and as part of the things that we learned from the campaign of things that we ceased to eat. And we learned a lot from the COVID, as I mentioned, in terms of the inflammatory response. And I mentioned this specifically with vitamin D. So changes in dietary changes. It is deficient in vitamin D, zinc, and other nutrients. And we have done testing specifically of the natural anti-inflammatory effects. And something very interesting we found not just in allergies and inflammatory response, but in cancer as well. I know this is not the topic but cancer levels have increased also due to pollution. So we launched this proposal, this campaign of I only drink water. And when I say I only drink water, we take care of the planet. We better preserve our resources. Our bodies function better. We prevent diseases that are related to sugary drinks that also cause harm on the kidneys and many other organs. And we reduce the risks of obesity, which is an inflammatory process by itself, and that provides inflammatory responses for people with asthma, for instance. So we launched these proposals with the intent of making causing people to only drink water as a domino effect and impacting the newer generations. And we also proposed as part of the things that we've seen, because unfortunately in Mexico we have over 170 schools of medicine, and all of them teach in different ways. So they dedicate different time frames to different teachings and courses. There's no standard in terms of health education in Mexico. 16 years ago, we published a paper related to pediatric teaching in pre-grade and postgraduate studies, and we propose a 10-point paper for proposals, and I will share it with you. And sadly, we have made very little progress in terms of this, and we don't have a lot of advancements in newer technologies, AI or web use. In the future, there will be applications of technologies and gene measurements and many technologies, but we are forgetting the most elemental aspects. How will we promote proper food and dietary habits and exercise, and the ability in health to adapt to the changing situations such as stress, anxiety, um, emotional regulation. And each of these topics may seem separate, but they are actually interconnected, because with the increase in temperatures, people get anxious, they get a lot of stress. There are more car crashes, for instance, they get in bad mood. And this impacts health as well, impacts the respiratory system and their responses. So we were talking about a research that we did for disposable diapers, and I found it really impressive when we reached conclusions of the amount of tons that are produced and mismanaged. These tons and tons of disposable diapers that are also pollutants and that are part of climate change and are impacting climate change. So there is so much to discuss. I was really inspired by your topics and from what you mentioned of the pamphlets and the recommendations and recommendations, for instance, of greener areas and greener spaces. In this next November, we're having a symposium, a 3-day symposium. We named it. We had we came up with a very particular name. It's called Racing with a Purpose. And this means that it will depend on where you're born, who your family is, what are their customs, what is their economic level and cultural level and social level, for us to have an idea of how well will you do in life in terms of health. So we want to begin with providing information and giving the opportunity for all of those that are less advantaged to reduce the gap, to break the cycle, and to achieve what we call leadership. Leadership is each person being capable of making their own decisions in terms of their health and have an objective for their health in life. And where this is written, how do we do it? We need to educate the newer generations of children that have mothers that take care of their diet from the very beginning, that take care of the children, and they probably do better in these times of war, of massacres that we see in Mexico, of terrible things that are happening in Mexico. The first thing that comes to my mind is, what did this person live, that these persons that are capable of doing these terrible crimes, what did they experience back home? And it may seem off topic, but this is actually correlated because in many parts of the world, they still cook with coal, for instance. They still consume natural resources not efficiently because we have reached 9 billion people in the world. So the hydrological stress alone is a consumption of 18 billion liters of water per day. And, 3 out of 5 children don't have access to drinkable water. So there's a lot of things to be covered. And this is important because you mentioned, the Saharan desert sand, it actually reaches us. And the LA wildfires, you may seem far, but this actually impacts us as well. So yeah, I would like to ask you as a form of reflection for your excellent lecture, scientific and wonderful lecture. I will ask you, what is your recommendation or your final message for people who will be watching this video in terms of, they can say Dr. Williams wants to give this final message to them. How can we take care of our planet and our health to make sure that in the future it doesn't take our breath away and we're able to breathe?
And thank you. And all of those are great examples of what we talked about with mitigation when you can and adaptation if you can't totally mitigate. I think I go back to my objectives that I talked about at the very beginning of the talk. And it's important to understand what these pollutants are, the importance of air pollutants and health, be able to recognize the vulnerable populations so you can identify at-risk patients, and advocate for change to try and educate people about it, educate caregivers and children, as you mentioned, but also try and reduce our reliance on fossil fuels and try and find alternative forms of energy for the entire planet. And as I mentioned, the burden is mostly not from the poor or underdeveloped countries that are producing the carbon dioxide. It's the more developed countries that are doing that. So it's important to focus on those. And then just again, advocates and identification and education.
I agree with you 100%. And I would only like to add that in the particular case of Mexico, we need more research. Unfortunately, 80% of the research that is made is informal, is not published. And this is sad because there's very few magazines and very few papers that are published. And we, our group, medical group, we have to publish in European magazines, for instance, or outside Mexico. We are forced to do so. And another aspect is that there's no support and there is no help for research. And there's a lot to be done because as we see in the United States, which is a country that's a mosaic, it's not the same US in the north or the southern US or East Coast or West Coast. Same goes with Mexico. Northern Mexico is not the same as southern Mexico, and Gulf of Mexico or the Pacific region, we're different. So we need to find solutions that adapt to our conditions, to our regions, to our ways of living, to the dynamics of our habitats. For instance, the Gulf of Mexico region where I'm located, we know when we have respiratory problems due to seasonality and changes in environmental pressure that change due to depending on the time. We are aware of this. The problem is that what works well in one region or in one country in Spain or what worked in Cape Town, how can we adapt this, for instance, to our conditions, to our capabilities, to our attention? And my conclusion is that we need to guarantee that people have access to a health system, access to information, and that there are programs, awareness programs, and research programs in place so we can reach better results. Would you like to add something else to wrap up the conversation before we end?
No, I think you've done a great job of outlining the problem. You need to really identify solutions in other places and try and apply them to your location when it fits. And we have to work together in a global fashion and not so much as individual countries.
I'd like to acknowledge that the American Academy of Pediatrics, with Marius Lajie and Sandy Chung, participated with us in the last 4 years. Unfortunately, we lost touch with the American Pediatrics Association, but we would love to have forums and conversations and hear opinions to compare and listen to suggestions as a brainstorming of sorts, because it all adds up and helps to enrich in the environment of opinions, not just to have a single opinion or as individuals. So hopefully we'll continue our great relationship with the American Pediatrics Association and the American Allergy and Immunology Association. We'd love to have conversations with them for the next events that are organized by our fraternity, Médicos, Unidos por Mexico, and the College of Physicians. And we have this great connection with the Universidad de Valle de Mexico and Veracruz University. And I think we can achieve great things helping each other. Thank you. On behalf of the fraternity, Medical Fraternity for Health, Médicos de Mexico, from the state of Veracruz, I would like to thank you for the wonderful lecture. Thank you, Dr. Paul Williams. And I would like to thank the participants that joined us via Zoom, via Facebook. The recording will be available in our YouTube channel in a few minutes. Thank you, everyone, and have a great evening, and see you soon.
Thank you for the invitation, and I'll be happy to help where I can.